There is one thing that seniors can do every morning to slash their risk of stroke by 50%. And it's not what you think. So keep watching. I'm a doctor. I'm an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. I've created this video series to help answer some of your medical questions and the questions that come up most often in my emergency room. If you find this video helpful, please subscribe. Well, it's basically the same mechanism, but the blood clot that goes to the brain only blocks blood flow for a short period of time. Well, about 15% of people over the age of 80 have atrial fibrillation, and about 15% of people with atrial fibrillation will have a stroke each year. One is just to get regular checkups with your primary care doctor. Have your blood pressure checked. This is a cardiac monitor. One is to wear a continuous cardiac monitor, something like this. You can see it's about the size of a cell phone. This has leads that come out of it, and they attach to your chest. And it continuously monitors your heart rhythm 24 hours a day. That is to check your heart rhythm first thing in the morning when you wake up. So imagine this. You wake up in the morning, and you get up and you feel fine. You don't feel sick. You don't feel weak. You don't feel tired. You don't feel fatigued. You're living a healthy lifestyle, eating well, exercising. You can actually reduce your risk of stroke by 50%. You just feel normal. Your body is not going to tell you that. But behind the scenes, your heart rate is 120 beats per minute, and it's doing it in a very irregular fashion. I'd be happy to answer them for you. You're probably not going to notice that. And that's atrial fibrillation. But if you check your heart rate first thing in the morning when you wake up, you can probably pick it up. You can feel it. It's going to feel like your heart is racing 7 days a week. You want to talk to your primary care doctor or go to an urgent care or the emergency room. Now, this can be done either through pills that you take or electrical cardioversion. You want to be on some sort of blood thinning medication because you're really at high risk for stroke. The reason being is because of that blood clot that caused this initial stroke or transient ischemic attack. That blood clot could still be there. And if you're at risk for more blood clots, there's a chance that another blood clot could form. And that's why it's very important to be on some sort of blood thinning medication. These include things like warfarin, Eliquis, Xarelto, Coumadin, those types of medications. This is where we put pads on your chest and we pass a small electrical impulse through your body. And what that does is it kind of shocks your heart back into a normal rhythm. And it works pretty well. About 70% of the time, this will convert your heart rhythm back to normal. And once you get there, they're going to hook you up to a cardiac monitor. They're going to confirm that diagnosis. And they also gonna test your blood to make sure that you not having a stroke because you may not show any symptoms. But if they catch it early enough, there is actually medications that we can give you that will reset your heart rhythm and stop that atrial fibrillation. And it looks for any episodes of atrial fibrillation. Now, the downside of this is that you have to wear it all the time. You can shower with it. You can sleep with it. You can do everyday activities with it, but it's definitely an inconvenience. It's a hassle. You have wires coming off of you. Make sure there's no other risk factors that can contribute to having a stroke. These include things like diabetes, high cholesterol, smoking, heavy alcohol use, and a history of clotting, things like that. Usually, it resolves on its own, and you may not even know that anything has happened. The connection to atrial fibrillation and a transient ischemic attack, which is also called a mini-stroke. So, what can you do about this? But this is a warning sign that you're at risk for a larger stroke, a bigger blood clot that stays lodged in the brain and causes permanent damage. Hi, everyone. This is a patch that you apply to your chest. It lasts for 14 days before you need to replace it. And it does the same thing. It monitors your heart rhythm for any episodes of atrial fibrillation. Now, The benefit of this is that it's easy to use. You just apply it to your chest, and it lasts for 14 days. The downside is that it only stores about 3 days worth of data. So, if you have an episode of atrial fibrillation, you might not get caught in that window. Alright, one thing that seniors can do every morning to slash their risk of stroke by 50%. There are multiple ways to screen for it. One way is using a device like this. This is a handheld device that uses an electrocardiogram and ECG. It basically puts small sensors, pads on your hand and on your other hand, and then you place them on your chest. And then you take a reading, an ECG reading, and it tells you whether or not you have atrial fibrillation. Now, this is great because it gives a definitive yes or no answer. But it only checks your heart rhythm at that one moment in time. Now, there are so many different things that contribute to strokes, so let's kind of go through the basics here. A stroke occurs when blood flow to part of the brain is interrupted, either from a blockage or a bleed. Atrial fibrillation is a problem with your heart. It's a problem with your heart rhythm where the top part of your heart, the two upper chambers, are beating very fast and they're beating in an irregular fashion. When this happens, the top part of the heart doesn't have time to kind of contract properly and squeeze out all the blood that's in those chambers. So the blood kind of backs up into the left atrium and it starts to pool. And within that pooled blood, it allows for these blood clots to form. Now, if one of those blood clots breaks off, it can travel through the bloodstream to the brain and lodge in one of those arteries that supply blood to the brain. And that's called an ischemic stroke. When that happens, brain cells begin to die after about 20 minutes without oxygen and glucose. The type of stroke that we're talking about today is called an ischemic stroke. This occurs because there is a blockage in the artery that supplies blood to the brain. And one cause of that is atrial fibrillation. What exactly is a stroke? Now, what is atrial fibrillation? So what exactly is a transient ischemic attack? So how common is this? Alright, so now you understand what a stroke is. Well, there's a few things that are very important. The most important thing that you can do to prevent a stroke is to watch your heart rhythm. And there's really only 2 ways to do this. The other option is to use a device like this. Now, if you're at risk for atrial fibrillation, talk to your doctor about getting screened. You should be screened regularly for atrial fibrillation. And that brings us to the one thing that seniors can do every morning to reduce their risk of stroke by 50%. Please comment below. Let me know if you have any other questions. Once you know that you have atrial fibrillation, it's very important to get to the hospital right away. One of the medications that we commonly use for this is called cardioversion. After your heart rhythm is converted back to normal, and if you're able to control your atrial fibrillation, you're able to keep your blood pressure under control. Alright, I hope you found this video helpful. Alright, I'll see you guys next time. Bye.